as we continue to mark Mental Health Awareness Month, we'll continue our discussion around how spirituality can play a role in dealing with mental illnesses. That's often, there's often stigma around mental health in some communities, while experts are calling for some kind of collaboration between spiritual and traditional leaders, as well as those who work with Western medicine. Some examples of this could be, seeking a religious psychologist, for instance. So let's try and unpack this for you now. Bring in a member of the South African Society of Psychiatrists, that's Dr. Gagu Matsebula, who joins us via our video link this morning for a sense of what we should make of this. And Doc, it's great to have you on the program. Thanks very much indeed for being brave enough to help us decode some of the complexities around mental health and spirituality. And perhaps we can start with that. How well do you reckon we are doing when it comes to understanding these two realities, especially because some people will tell you that, for instance, a spiritual calling may very well manifest in a way that, sometimes a mental illness may manifest. So are we doing well with distinguishing the two, if at all?
Yes, good morning. Thank you for having me. So definitely one of the criteria that we use as psychiatrists in the diagnosis of mental illness is there a spiritual or a cultural explanation for what the person is experiencing. The example that you've just given of someone experiencing certain symptoms when they have a calling usually has an explanation and a solution to it. We do see that those people will tend to undergo shall we call ukutwasa, for an example. So yes, an awareness is there, and that awareness definitely is increasing, definitely on both sides, from psychiatrists and on the spiritual healer side.
It's good to hear, because in the past there have been real concerns about a lack of collaboration, quite frankly, which leads to misdiagnosis in some instances. How important is it for, let's call it, both groups of healthcare providers to have at least some kind of knowledge about the kind of solutions that lie on the other side, for lack of a better term?
It's absolutely important. When we talk about an entity or group of entities as complex as mental illness or mental health, there has to be an understanding that the treatment just doesn't involve the provision of medication, but it also involves things like psychosocial services as well.
Yeah.
This is where our healers then come into play. They provide a very important role in terms of offering forms of counseling and social support as well. So indeed, that collaboration is absolutely necessary, and that is where we can actually get the optimal outcome for our patients.
Yeah. With mental health and spirituality, there may very well be very serious stigma that prevents patients from receiving the kind of assistance that they desperately need. And sadly, what comes with stigma is also operating in the wings, so to speak. What I'm trying to say is people will often try to hide their real experiences because they're afraid of what the stigma may come with. To what extent does that hamper your efforts as psychiatrists and perhaps some of the people you work with who are spiritual healers in providing the necessary support and assistance?
So yes, and unfortunately, there's a myriad of historical reasons that will lead people to not feel comfortable or to hide the fact that they are consulting a spiritual healer. And I think the solution to that is to have an open relationship with one's patient. The patient should feel comfortable to talk to their doctor, not just a psychiatrist, to say that, look, this is what I'm thinking and this is what I'd like to try. And then at that point, the practitioner would then have to have a discussion with the patient to talk about what's going on and certain things to look out for. And just to give you a quick example, there are certain medications that we use which do not want a person to be dehydrated, for example. So if a person is going to go see a spiritual healer and maybe they'll be given an enema or they'll undergo some form of steam therapy, then we can have a discussion with the patient to say that, look, you're on this medication, these are the possible dangers if you should get dehydrated, and these are the steps to protect yourself, and to tell them to feel comfortable to talk about when they go to see a spiritual healer. Because what we do see, unfortunately, is that if we do have certain complications that happen when they go to see another doctor, another healer, for example, and they come back and they have certain complications, the psychiatrist has to be aware, and the psychiatrist has to be able to do certain investigations like taking blood to make sure that the liver and the kidneys are fine due to certain interactions between medications that we may give and the treatments that spiritual healers may give.
Yeah. For the most part, our discussion has been around a spiritual healer being a completely separate person from a psychiatrist. The reality, of course, is that this can be occupied by one person. In other words, you can find one individual who may very well be able to provide both types of solutions, as it were. How many of those kind of people do you reckon exist? And from what you know, is there enough space for them to, I guess, explore both sides of providing this kind of relief for their patients?
Yes, the scope for that definitely is there for both services to be provided. And as I alluded to earlier, mental illness is an extremely diverse, complex group of entities. And to provide optimal treatment, it's a combination of medication and psychosocial services. And that then throws in things like counseling. So the scope definitely is there. And the Constitution definitely mandates it. Section 27 is quite clear. Access to healthcare is a basic human right. And we must do what we can to work with the patient within certain boundaries, of course, to ensure that an optimal outcome does prevail at the end of the day.
Right.
So scope definitely is there.
That's good to hear. Joining us now is also traditional leader, that's Zikho Ezethu Zatu, who's also with us via our video link this morning. Zikho, if you're able to hear us, thank you for making time to add your perspective to this otherwise very complex discussion. From the work that you've been able to do, how much of a role do you reckon traditional medicine plays in addressing mental health issues, especially in our context here in Africa?
Thank you so much for having me. With regard to traditional medicine and spiritual healers, we also help with people to channel or to understand that not everything is about spiritual being. Also, not everything that is happening mentally, it's about spiritual attacks. You have to understand that we are all humans. We all go through certain things, especially mental health issues, which is why it is very important to also help them seek help or seek a professional help, that is, see psychologists, which is something that I always advise in my consultation room. When someone is having mental breakdowns and when having a mental health issues, you should always seek a professional help, that is psychologist. Not that traditional healers and spiritual healers, they don't do the professional help, but also hearing something spiritually or that have to do with spirituality can also affect your mental health. So which is why it is very important to advise someone when they get out of a consultation room, should anything overwhelm them, they should go and seek a professional help, that is, talk to a psychologist so that they can help them digest whatever it is that they've been hearing from the consultation room.
Sure. That's very interesting that your first point of sort of addressing this would actually to advise people to seek, professional help, as you put it. But discernment is also incredibly important, and I imagine people would want to be able to be equipped to discern for themselves at a start about where to go first. How should they go about that before, essentially leaving their home to go try and seek help, Zikho?
If I may explain a bit further, that should you go to, let's say you come to me as a spiritual healer or as a prophetess, and then I tell you this and this about your life, and then later on I do tell you that some things do not happen spiritually or are not a spiritual attack. So if we are having an honest conversation, that I tell you that things that are happening at the moment are not spiritual attack. It's your mental health affecting you. You should go to a psychologist, because I am not professionally trained to be a psychiatrist to someone else. I am just a prophetess, and I have to do spiritual work, and then you will seek a mental health issue with the psychiatrist. if I'm explaining it better.
It's crystal clear. And it actually introduces a very interesting element, Dr. Gagu, to our discussion. I mean, Zikho is speaking about being able, as the one providing the assistance, to identify your limitations so as to hand over, if you like, to somebody else who might be able to provide that assistance. As psychiatrists, at which stage are you able to identify where your own limitations are and realize that you've now entered the realm of traditional healing and spirituality? How do you do that?
So we use two things. The first is to talk to the patients themselves and to talk to the patient's family. And the reason that we do that, as I mentioned when we were starting, is to find out is there some form of spiritual or cultural explanation for what this person is presenting with. And definitely there are certain phenomena that will present with what looks like a mental illness. It is at that point that then we can then say, okay, this could be an explanation, but let's definitely try this route of medication that we can give. And if the sense by the patient is that, doctor, I'd actually like to go try out with the spiritual healer first, then I think that should be fine. They have every right to do that. The important thing that we as psychiatrists then do at that point is to explain to them that A, the door is open if they want to come back, and that B, there are certain medications that we can definitely try to ameliorate the situation. And then lastly, to say that there are certain mental illnesses that the longer we take to start treatment, the worse things can get. But the key is just to have an open therapeutic relationship with one's patient and a collaborative approach with healers like we have with my co-panelists there.
Yeah, and Zikho, as we round up our discussion, honesty and being able to speak freely, at least to my mind, are at the center of being able to get the kind of assistance that any patient would need, whether from a spiritual and traditional healer or from a psychiatrist. I wonder, from the work that you're able to do, whether you get a sense that people are able to open up in the ways that they need to, so that you are able to direct them. Because part of the discussion I was having with Dr. Gagu a short while ago is around how people sometimes will hold back because of the perceptions that they think will come out from, being bare about their experience.
Yes. The great thing about being a spiritual healer is that sometimes you go through certain experiences in life so that you can heal people with empathy and sympathy, so that you can understand the pain and whatever feelings that they are going through. So when you get to that point, some things are revealed to you as a spiritual healer, that this person went through certain traumatic experiences. That's when you start talking about them, but you need to talk about them in a very much sympathetic manner, so that you do not just address anything in any manner, so that you empathize with that person, because you have been through this as a victim of certain traumatic experiences too. I do get patients who have been through what I've been through, so I understand what they are feeling. I understand what they are going through. I understand that sometimes they will not talk, so I will just tell them, I went through this. I went through A, B, C, and D too. I understand what you're feeling. You do not have to say anything to me, but you can seek professional help, because this thing cannot be healed spiritually. Also, another thing is that people tend to mistake that spiritual healers and psychiatrists cannot work hand in hand. They can, if we are having an open and honest conversation. Because some people who want to heal people on their own, forgetting that there are certain aspects of life we cannot get through. There are certain limitations in our lives. So we have to understand our limitations and boundaries, and then send someone or advise someone to go seek another help. You can help a person up to a certain point, and then you can let them go and see another person, or advise that they should see a psychiatrist or psychologist, whatever that they will be helped with via mental health, because we cannot help people spiritually only and accept them or expect them to be okay mentally and everything else, because even the things that are being seen or being said in a consultation room spiritually, they can make someone else have mental health issues or mental breakdowns because of the messages or the messages that they are getting from their guides and their ancestors.
Right.
So when someone says that, okay, this and this and this happened, so you can now seek a professional help because this cannot be healed spiritually.
Loud and clear. Thanks very much indeed for weighing in. You know, this conversation in the past has largely been dichotomous when we speak about Western medicines, so to speak, and traditional and spiritual healing. Good to hear that there's a lot of work being done to merge these two, especially when you consider that it's all for the benefit of the person seeking help. So to both our guests, thanks very much indeed for your time. Dr. Gagu Matsebula is a member of the South African Society of Psychologists, or Psychiatrists, I should say, and Zikho Ezethu Zatu is a traditional healer. To both of you, once again, thanks very much indeed.